Hi families, I'm teacher Marisela and I will be reviewing with you today reasons when you will need to keep your child home from the center. The information that I am giving you comes from the Los Angeles County Department of Public Health and from the Center of Disease Control and Prevention, or the CDC. So your child will have to stay home when they are sick. If they are having symptoms of respiratory illness, such as fever and cough, your child must remain at home in isolation. They must not return to the center for a minimum of 10 days after the onset of symptoms and until their symptoms have improved. They must also be fever-free for at least 72 hours without fever-reducing medication. So let's talk about what that means. Some of the symptoms that we will be looking for is respiratory illness. Now that sometimes will look like irregular breathing, hard to breathe, a sore throat, congestion, and coughing, whether it's a mild cough or a severe cough. Another symptom that we will be looking for is fever. A fever is 100.1 or above, or just plain fatigue. I wanted to give you an example of what it meant for your child to safely return to the center after they have been symptom-free. So let's say your child gets sick on the first with a fever and a cough, and then those symptoms will continue on for a second and a third day. Now, by day 4, their fever has gone away completely, but they continue to have a cough. It is now day 7 and your child no longer has a fever or a cough. They are officially symptom-free. Now you will wait a minimum of 10 days to make sure that your child's symptoms do not return or new symptoms occur. Now it'll be safe for your child to return to the center. Now, while the virus is the most contagious when the infected person is clearly ill, some individuals may infect others when they don't have obvious symptoms or any symptoms at all. Given that risk, children who have been exposed to someone who has respiratory illness should remain home for 14 days to see if they also develop symptoms of illness. Home quarantine of an exposed child reduces the chances of spread to other children, staff, and their families. If no symptoms appear within those 14 days, the child may return to the center. So if you have a date of exposure or a date that you could have possibly been exposed to someone who has tested positive to COVID-19, you must wait 14 days. These 14 days will determine if you have symptoms. They will determine if you could possibly be a carrier with no symptoms. In that event, it is safer for us and for everyone in the facility for the person with the possible exposure to stay home. They must wait those 14 days before it is safe to return to the center. Reasons your child might be sent home may include vomiting, rash, lice, diarrhea, eye infection, runny or stuffy nose, fatigue, or if your child is just plainly not feeling well. Remember that these are guidelines to help keep everyone at Families Forward Learning Center safe and healthy. We hope that you can help us by following these rules and by using your best preventative measures before coming into the center.